What is an EMR system? Well, EMR stands for Electronic Medical Records. It gives access, it keeps track of patients' medical records instead of having to use a paper trail. So this makes it a lot easier for medical institutions to be able to keep track of things and not have to worry about a big file folder or anything like that. It also lets patients keep track of their own medical records on an app on their phone or some web-based system. It can be web-based or on-site. Web-based meaning it's a SaaS or software as a service. And on-site means that it needs an on-site host where all the information goes to the server. It can be used on any wireless device, so most of the time you'll see medical institutions them having an iPad walking around with it, which makes it a lot easier for the doctors and all the medical personnel to be able to keep track of the data while they are working with the patients.
Thank you, Emily. Now I'd like to talk about electronic medical record systems in business. They're used by two main functions, the operations and the accounting departments. In the operations departments, they're used by doctors and nurses for daily patient care. By keeping track of the information on one central database, doctors and nurses can communicate effectively and provide quality service for each and every patient. They're also used by the accounting department. In the accounting department, they're used by the accountants and the financial personnel for billing purposes. By having the information about the testing and procedures on one central database, this department can properly bill the patients and provide quality service overall. Now I'd like to show a video by the Cleveland Clinic about implementing EMR systems in Ohio.
What we announced today is the allocation of federal resources combined with state resources that will enable thousands, 6,000 or more physicians to have electronic medical records technologies available to them so that we can improve patient care, we can control costs more effectively, we can make it more likely that patients will not be over-tested or over-prescribed.
Upside opportunities are enormous. We're going to move to the point where a patient can expect from anywhere in the world to be able to see their actual medical results, to be able to follow guidelines and recommendations that are coming from their patients. And for physicians, they will be put in a position to better coordinate the care for a given patient because all of the individuals involved in that care are using an interoperable electronic medical record.
Now that we've discussed EMR systems in business, let's move on to the costs and benefits of these EMR systems. On to you, Dan.
Okay, now we're going to talk about different costs of electronic medical records. And that depends mainly on whether it's a web-based electronic medical record or a on-site one. As you can see in the table, the web-based upfront cost is less than the on-site one, but each year's cost is greater. Now these estimates are averages and they can change based on a variety of cost factors, such as maintenance costs, training, networking fees, etc. We recommend that Vets for Pets implement a web-based EMR because they do not have the IT personnel to run a on-site one. Now with benefits, an electronic medical record benefit both the patient and the medical institution. They improve diagnosis and treatment. The medical professional has updated and accurate patient information, which reduce response times to patients. Also, they can use electronic medical records for e-prescribing. So the main goal of electronic medical records is to, one, increase the quality of care, and two, being more efficient with resources. And you can see this because doctors do not have to dig through papers in order to find what they need. They also reduce errors within institutions. And it's so important that everybody in the office understands the benefits in order to successfully implement an electronic medical record. So now onto limitations. They do not fully relate to patients' needs. Also, there's an issue with compatibility of electronic medical records. According to the National Coordinator of HIT, only 48% of physicians and 82% of hospitals share health information, which results in a gap of information which isn't good for patients. Now onto risks. The number one risk is cybersecurity, and security breaches continue to increase. Also, employees may find it difficult to use. So training is important. Also, physicians believe that many of them believe that the electronic medical records interfaces do not work correctly all the time. So the key aspect of electronic medical record is convenience. So it's so important to find the right system and training all the employees to use it so that you can be more productive and more efficient. Now Cody's going to talk about 3 different vendors that provide the electronic medical records.
Thanks, Dan. One example of an EMR service provider is Epic. It is used by more than 250 healthcare providers nationwide, and about 45% of the US uses Epic. It makes it easy for hospitals and other medical facilities to keep all records in line and in use through one program. Patients have access to their own medical records through a website, and Epic also allows hospitals to share records with other facilities, making it even more convenient. Another service provider would be CureMD. It is highly respected because of its compliance with HIPAA and health information technology regulations. It is one of the most affordable systems and yet still offers impeccable performance within all of its programs. Along with its electronic medical records, it offers many features and accessibility options such as e-prescribing electronic labs and a mobile app for patients to even access their own health information. Lastly, the service provider would be Allscript. Allscript is used by various types of healthcare providers. They are involved in small, medium, and large companies and also provide modules for emergency rooms, wound care, surgery lab systems, and ambulatory clinics. They also have an e-prescribe system that works very well along with its EHR system. And now for some case examples.
Thank you, Cody, on the information regarding several common service providers of EMR systems. My name is Thomas Flock, and I am here today to talk to you about a couple of companies who implemented the use of EMR systems and what we thought had a great amount of success when they did that. So the first company I'm going to talk about is Texas Health Resources. And Texas Health Resources, they are a faith-based, not-for-profit health system in the North Texas area, which is mostly like the Dallas, Fort Worth area. And they are a fairly large company. That area has over 7 million, roughly 7 million residents. And the health system has over 29 hospitals and over 350 different like inpatient, outpatient facilities. So it's a fairly vast network of employees, patients, and just people in general. So we really did see success when they implemented the electronic medical records, just because it made it more convenient for the technicians that work at those different locations to pull up, say, information about a patient that went to a different location and is now asking about it at the current location they're at, and they don't have to go track down like a hard copy at the specific location they're at. And the other company we researched was the DuPage Medical Group, and they are a independent multi-specialty group of physicians in the Chicago suburban area in Illinois, and they're also a pretty big company in that they just serve basically the whole suburbs of Chicago. And since they're independent, there's no really like centralized location for them. They also have over 100 locations, and really like when they implemented the electronic medical records, it really helped them with convenience for their customers, as they could pull up any information regarding that specific customer's like past visits with any of their physicians or any of their medical records. And that's really the main benefit of these electronic medical records is convenience and improving the customer care. And just that they can be pulled up electronically. They don't have to be pulled from a specific hard copy at a specific location. So it really just improves the continuum of care for customers, and we really do believe that to be important in the industry, such as like health services or, in this case, veterinary clinic. And with that being said, I'm going to hand it off to Emily for our final recommendation on an EMR system. Thank you for your time.
We recommend that Vets for Pets chooses CureMD as their vendor. It is a low-cost system, which is best for Vets for Pets since it is such a small business at the moment. It is web-based, which we also feel is best because Vets for Pets does not have IT personnel to be able to operate an on-site host. CureMD results in fewer errors and has more opportunities to grow successfully. CureMD assures higher quality and is a paramount as a healthcare service to be able to maintain patients and to grow throughout innovation and expansion. The next step for Vets for Pets should be to research all EMR systems and find out what fits their needs best and utilize that system. Then they should train all of their employees and make sure that everyone is educated because, as all technology can be a little difficult. So the sooner that they train and make sure everyone knows what they're doing, the easier it's going to be, and they will save time and money in the long run.